This is a review of the external anatomical structures of the heart using the small heart model. So let's observe again from the ventricles upwards. The apex of the heart is here. If we were to think about a mountain or a pyramid, we would say its base is at the bottom and the apex is at the top. In this particular case, we can say that the base is at the top and the apex of the heart is at the bottom. So the inferior aspect of the heart is its apex, the superior aspect of the ventricles is its base. So that's the beginning. Then we can say that we can observe some basic structures of the heart. This is the coronary sulcus. Sulcus is an infolding. Within the coronary sulcus, we have the cardiac vein. Here we can see we have the great cardiac artery. We can see that we have the left ventricle and the right ventricle. The septum would run down the center. This, what we see as far as this yellow matter in here, is the heart skeleton. The heart skeleton is connective tissue that supports the different valves, the cuspid and semilunar valves. As well, it acts as an insulator to keep electrical signals occurring in the atrium from affecting the ventricles. So this is what we see as the heart skeleton. Above the ventricles, we see atria, the right atrium, the left atrium. Covering the outside of the atria are auricles, small ear-like or ear-shaped flaps of skin. And those auricles we would see here covering the atria. The atria itself are holes within, we can see if we bring in a large model, holes, of course, and they are covered by an auricle. Auricles cover atrium. Further, we can see that there are veins and arteries on the heart. What we have to remember is that an artery carries blood away from the heart, and veins carry blood to the heart. Normally, an artery would carry oxygenated blood, and a vein would carry deoxygenated blood. The interesting thing about the heart are veins and arteries which enter and leave the heart are opposite. Arteries still leave, veins still enter, but in this case, veins carry oxygen-rich blood and arteries carry oxygen-poor blood. So let's look at these arteries and veins. Pulmonary arteries and pulmonary veins. Pulmonary arteries are leaving the heart and going to the lung. They come, the blood from this comes from the pulmonary trunk. So as blood leaves the right atrium and enters the right ventricle, it goes through the pulmonary trunk, the pulmonary semilunar valve into the pulmonary trunk, from the pulmonary trunk into pulmonary arteries, which are going to the lungs. From the lungs, blood enters pulmonary veins, right pulmonary veins and left pulmonary veins. These enter the atria and are oxygen-rich. So pulmonary trunk, pulmonary arteries, pulmonary veins. Now we see that some are red and some are blue. Blue means they have low oxygen, red means they have high oxygen. Let's look at this structure here. This is the aorta. This is the ascending aorta as it rises up out of the heart. This is the aortic arch. Coming off the aortic arch, on the right side is the brachiocephalic trunk. In the center is the common carotid, and to the left side is the subclavian artery. Let's look at another blue structure. This structure here, we can also see a little bit of it here. This is the superior vena cava. This is the inferior vena cava. These are the external structures of the heart on the small heart model.